Assalamu alaikum everyone. Welcome to Medicine by Trips. And today we are here for the examination of blood group systems. As we all know that different human beings have different blood groups, and these blood groups are determined on the basis of specific antigens present on the surface of RBCs. These antigens vary from person to person, even within the same family, and therefore we have different blood groups. So according to these antigens, we have classified blood groups into several different types, but to our concern, the two most important systems are the ABO system and the RH antigen system. First of all, we are going to study the ABO system. So in ABO system, we have three major antigens, the antigen A, antigen B, and antigen I. These three antigens together, they determine four blood groups, and blood group A, blood group B, AB, and blood group O. So as you can see here, the blood group A have two antigen combinations, the antigen AA or the antigen A with an I. Basically, these blood groups refer to the dominant pattern of the Mendelian inheritance. And the patients having the blood group A have an anti-B antibody in their blood groups. Number two, we have blood group B. Similarly, as blood group A, they also have antigen B with combination with I, and they have anti-A antibodies in their blood group. Now, these antibodies are very important as we'll see them in transfusion reactions. Next, we have blood group O. They have basically I antigen, and they have both anti-A and anti-B antibodies since they have no antigen A or B on their surface. And the people having blood group AB have a combination of both antigen A and antigen B, and hence no antibodies. So first of all, the question arises that why do we need to study the ABO system? Well, it is very important for the transfusion reactions. If the patient having blood group A has received accidentally the blood group B, so his blood will start producing antibodies against those antigens, and hence will result in graft rejection or hemolysis reaction, which can be at times life-threatening. Next up, we have RH system. The RH system basically composed of 6 antigens, capital CDE and small cde. These antigens basically determine the blood group whether positive or negative. So to our concern, the most important antigen is D, since we can see here the presence of D antigen makes your blood group positive, whereas the absence of capital D antigen makes your blood group negative. Now, the clinical application of this RH system comes in erythroblastosis fetalis. This is a clinical representation where an Rh negative mother conceives an Rh positive baby. As a result, during delivery or due to placenta tear, some of the antigens, fetal antigens, may enter into the mother circulation and hence provoke the antibodies production. As a result, the first pregnancy remains unaffected. However, when a mother conceives second, third, or so on babies, these antibodies can travel through placenta to the baby, and hence will result in hemolysis reaction, ultimately leading to the killing of the fetus. So that's all for our blood group systems. Next up, we'll move to the clinical or practical examination of this blood group systems. Thank you. Assalamu alaikum. So now we are heading towards the performance of this practical. So for that, we need this following apparatus. First of all, we will need an alcohol swab, a needle pricker, 3 types of anti-sera, anti-A, anti-B, and D antigen. And then we'll be needing 2 glass slides. One will be testing for the ABO blood group system, and the other one will be testing for RH system, that is either the blood group of the patient is positive or negative. So first of all, the protocol is that you have to approach the patient from the right side and take consent. So now we'll start the performance of this practical. Assalamu alaikum. My name is Asif, and I'm going to perform a practical on you. I hope it won't hurt you, but if it feels any kind of discomfort, you may inform me. Okay, so first of all, we'll clean the finger of the patient with an alcohol swab. Now we are going to take a pricker and slightly prick the needle. Okay, so first of all, we'll be needing 2 drops, one on the slide of A, and the other one for slide B. And next, we'll need 1 drop for this RH side. Okay, so we are done. Now what we are going to do is that we are going to add the respective anti-sera on both sides. On antigen A side, we are going to add 1 drop of anti-A sera. Now for B, we'll be adding the anti-sera B. And for RH side, we are going to add anti-D anti-sera. Now you are going to mix these two and you are going to check for the agglutination. Basically, you have to roll the slide for 2 to 3 minutes in order to check for the agglutination. And after that, you will be saving, there will be clumps of RBCs, which shows that so if agglutination occurs on side A, this means that the patient has blood group A because his antibodies reacted to those antigens. And if agglutination occurs on side B, it means that the patient has blood group B. And for RH, if agglutination is present, it means that the blood group is positive, and if agglutination is absent, it means that the blood group is negative. If agglutination occurs on both sides A and B, the blood group is AB, and if there is no agglutination on either side, it means that the blood group is O. And RH system is very simple. If you see agglutinated or clumps of RBCs, it means that the patient has positive blood group type, whether AB or O. And if there is no agglutination, it means that the patient has negative blood group. So as you can see, that there is clotted blood over the side B and also on RH side. So this patient has blood group B positive. And that's it for our practical. I hope you have understood everything. Thank you.
If you have any query, you can ask, subscribe to our YouTube channel, and share with your friends. Thank you for watching. Allah Hafiz.